Last week, we talked about a single sort of sensory system, and that sensory system was vision, right? We spent a long time talking about vision. We discussed that vision is probably the most important sensory system to humans. We're a highly visual species. We decided to put both of our eyes on the front. That's really important, right? Sydney, did I tell you? I didn't tell you about mules, did I? You want to hear a story about mules quickly because it's a good one. Anybody have mules? No. You scoffed at that. Like that was a ridiculous question. Who here has a mule at home? All right, nobody. So maybe that was appropriate. But how many of you have a horse? Okay. How many of you have a donkey? All right. Well, we're not getting a mule today. But so for those of you that don't know what a mule is, it's like a horse and a donkey together, and then you got something, right? There's some more details we can go into, but we'll skip that. Have you ever heard of a sure-footed mule, right? You know why mules are so sure-footed? It's the location of their eyes, right? And so their eyes are on the sides of their heads, right? They look kind of like a horse head, right? And horses can actually see like 300 degrees, right? We can only see maybe about 175 to 178, sort of depending on how far your eyes are, you know, give or take a few degrees. But the interesting thing about mules is when they're walking, they can actually see their back legs. So they can see their back hooves as they're going down. Horses can't do that, so that's why you should always ride a mule if you have a choice of a horse or a mule, because they can actually see where they put their feet. It's pretty nice, right? I thought it was handy. All right, so there you go, vision. It was fun. We talked about a lot of basic principles with vision, right? Those same basic principles are going to carry forward in the other sensory systems. There are going to be some differences. We'll talk about those. But when we talk about the auditory system, when we talk about chemical senses, that's going to be smell and taste. Or when we talk about the body senses, that's things like touch, tickle, pain, vibrate, hot, cold. We'll talk about those things. All right, here's a list of some of your senses. How many of you know you have 5 senses? Yeah, you're all wrong. You have more than 5 senses, right? I mean, if you really want to think about it, we already talked about vision, so that's 1, so you just put a 1 here. And then there's like audition is 2, and we already said there's like taste and smell, right? That's like 3 and 4. Vestibular system, that's number 5. That's so you know if you're standing upright or if you're on your side, right? Which that's a fun one. And then you have the somatosenses, which in and of themselves can be broken down into several categories, right? Laura, which ones am I forgetting? That's fine, but there are several, right? So there we go. So we have a lot of sensory systems. So let's just not think about 5 or some number, right? You just have a lot of them. So we'll quickly sort of go through different sensory systems. We'll highlight what's important, what's different, what's interesting, and then move forward, right? Probably the most important statement of the entire semester, we hear sounds. I know you guys didn't know that, so if you want to take a moment, let that sink in. You know, just really, yeah, it's going to change your world. You learned something new today, yeah. So we do hear sounds. How does this work? Some object vibrates. It vibrates some air. That's phenomenal. Those airwaves travel around 1,200 kilometers per hour. That's known as the speed of sound, right? Due to some contractual issues, I'm required at this point in the semester to mention Chuck Yeager. I have to say his name 3 times every semester. It's part of my contract. When I signed on, I have to say Chuck Yeager. Why would I have to say Chuck Yeager 3 times? And I've already done it, Sydney. He was the first person to break the sound barrier, right? So there you go. That's fun. We can hear things when they vibrate between certain frequencies. Not quite that low. Don't worry about it. Eventually, these sound waves, as they travel through, they're going to get into your ear. Right? There's your ear. They're going to go in that ear hole, and they're going to vibrate some stuff in that ear hole. Eventually, they're going to vibrate some what we call inner hair cells. They'll vibrate those cells, and you'll go, oh, well, I hear something. All right, here you go. There's maybe a slightly better drawing of your ear. It's going to come through this outer part of your ear known as the pinna, right? Or the outer ear. How many of you know you have a couple of these? Okay. They're really great for like hanging glasses, earrings, things like that, right? So they do, right, all kinds of stuff. They let you know how far to pull your hat down, right? Because right there they are. So you've got all kinds of good things you can do with your pinna. What I think is great is that all of you who are younger than I am are probably going to lose your hearing before I do, and I'm so excited about this. And the reason, yeah, I know, you didn't know this was going to happen, did you? But now you do. The reason for this is, how many of you own a pair of earbuds? That's what earbuds look like. How many of you use these more than you should? Well, if you own a pair and you've ever used them, you've used them more than you should, right? Evolution gave you an outer ear for a reason. That outer ear collects sound waves. It takes those sound waves and sort of filters and attenuates certain frequencies, in particular frequencies that are associated with the human voice, and then funnels those into your ear, and it's a beautiful process, right? What an earbud does is it totally bypasses that outer ear and just starts slamming around on the inside of your ear, right? And that's a bad idea. That's a really bad idea. So always go with the that's exactly what over-the-ear headphones look like, right? Always go with the over-the-ear headphones if you're going to go with that, right? Because you're still going to make use of your pinna just a bit, right? You don't want to bypass that. So there you go. How many of you are going to throw your earbuds away now? You should. How many of you are, just in case you've used them too much already, I want to yell. All right. So the pinna is an important part of the auditory system. We don't often think about it as an important part, just kind of that, you know, part of your ear hanging out there, right? What's it do for you? We don't think much, but it actually does quite a bit. It's designed in a very interesting way. It also helps you with sound localization, right? How many of you, when you want to try to figure out where a noise is coming from, you tilt your head kind of side to side, or you rotate it around, right? So it can catch those sound waves in a slightly different way. Just do that filtering process, and it can really give you some important information about what's going on. Right, Caitlin? When we're thinking about a sound, right, we have to describe that stimulus. When we were thinking about vision, we were describing light, right? We talked about frequency, you know, the wavelength, right, the hue. We talked about brightness. We talked about some other things. When we're thinking about sound, we have a few sort of characteristics as well. The first is going to be pitch. This is going to be related to the frequency of the vibrations. We measure this in hertz, okay? And that's going to be cycles per second, right? And what we mean by cycles is because we're kind of dealing with waves like this, right? One cycle is like how far is it from an up back to an up, right? That's like one cycle, okay? Or you can measure trough to trough as a cycle as well. It doesn't really matter. But typically we measure peak to peak. Okay, how many cycles of that sound wave go by a given point in 1 second, right? And that's how we measure that. The more cycles that go by, the higher the frequency, right? So if you want to measure this, you know, from low frequency to high frequency, you do that in hertz. Loudness is going to be the intensity of the sound wave, right? So it can have the same frequency, but the loudness is going to have, you can't see the bottom there, it's going to have higher peaks and valleys, right? That's going to be something that's louder, even if it's the same frequency, okay? And finally, we have the concept of timbre, which is a little confusing. Timbre is kind of small sound waves riding on top of a bigger sound wave, right? Anybody here a musician? Anybody play the clarinet? How many of you have ever seen a clarinet? You know they exist, right? Okay. So on a clarinet, you can play, let's imagine your favorite note is a, I don't know, like a B flat, right? Is that what a B flat looks like? Imagine it is. So it's a B flat, and let's say you're going to play that at, you know, 80 decibels, right? Okay. So we've got a frequency and we've got an intensity, right? A loudness. How many of you know that a clarinet sounds differently than a trumpet? Right? They're two different instruments, right? You can still play a B flat at 80 decibels on a trumpet. That's going to sound different than that clarinet, right? And the reason for that is going to be the timbre, right? It's going to be those other little small sound waves riding on top of that big main sound wave. And I would be really impressed, Laura, if you could tell me what that main sound wave was called. I'm not going to be impressed, am I? No. It's called the harmonic, but that's okay. So, here's the basic idea. Here is your frequency. So, low frequencies, this is kind of on the Barry White spectrum. Over here, we've got it on the Alvin Chipmunk spectrum, right? Okay, so from low to high. If you don't know who Barry White is, you are missing out so many social opportunities. And you should really spend some time, not in this class, but elsewhere, right, Kyle? Learning about Barry White and what that can do for your life. Will make your college years more interesting. So, and like one of you understands that, right? One of you. Thank you. Here's intensity, loudness, not a big deal. And here's timbre. So most natural sounds that you're going to hear are going to be kind of like fuzzy. They've got those extra little sound waves riding on top. If something is a pure tone, it's just going to be a simple sine wave. It's not going to have those other little sine waves riding on top of that, okay? But if you want to think about this, this could be like a clarinet, and then your trumpet's going to look a little different, right? It's going to have a different set of small sine waves riding on that. Not a big deal. All right. We've already talked about this awesome thing called the pinna. On the outside, it's going to funnel sound waves in to your tympanic membrane, also known as your eardrum, right? Okay. So those sound waves, because remember, we have to go from sound waves to an electrical signal, right? We got to do that sensory transduction process. Okay. We got to go from sound waves to electrical signal. How do we do this? This happens in your ear. Starts with your tympanic membrane. We get those sound waves vibrating that tympanic membrane. You vibrate your auditory ossicles. Those are your middle ear bones, right? You guys are familiar with those. The hammer, the anvil, and the stirrup, right? Here are the sort of Latin names for those. Not a big deal. The point of these three bones is you have to take this vibration of air and turn that into a vibration of basically like a jello substance, right? In your cochlea, you have a substance called endolymph. Okay? And this is sort of a gelatinous substance. So you're going from one sort of substance to another, right? And if you're not careful how you do this, you can cause some pain, right? How many of you have ever jumped into a pool of water? Right, you got a pool, and you just decided to do a belly flop, right? That can be a painful. That's a really great drawing. I saw the face you made, but that's a really great drawing. I'll put some swim trunks on him just to. And he's got just like hair streaming in the wind. When you go from air to water, that can be sort of a painful transition, right? How many of you have ever skipped a rock across the surface of water, right? Those things can happen, and when we're going from air to endolymph, if we're not careful, if we don't have this sort of step in the middle with these middle ear bones, we'll lose all of that information, right? Those sound waves will just come through, and they'll hit the endolymph, and they'll just bounce right off, and they won't cause any vibration. That information won't travel through the cochlea so that we can start vibrating those inner hair cells. All right, we already talked about those and those and the cochlea, right? So basically what happens, once those sound waves, they come in, they vibrate that tympanic membrane, that vibrates the auditory ossicles, they start punching around on the cochlea, and they vibrate the endolymph inside of that. That causes movement inside your cochlea, right? And in particular, it moves these guys called inner hair cells. Okay, these are important. When these cilia that stick up on the top of those hair cells move, they rip open ion channels. Okay. Previously, we talked about opening ion channels using neurotransmitters, right? Now, this is a completely different process, but the end result's going to be the same. You open an ion channel, ions come in, that changes that inside electrical potential, and that sends an electrical signal into the rest of your brain, right? It's the same idea. Instead of using neurotransmitters here, because we're coming from the outside world, we're going to open that up with some mechanical shifting and shaking, right? And that's how we're going to do this. The cool thing about the cochlea is the way that it's organized is what we call tonotopic. Okay, that's a fancy word that says basically one end of the cochlea is for high frequencies, one end is for low frequencies, and we've got them all organized in order in between. Okay, there's a lot more to that, but you don't have to worry about it right now. So when there's a frequency that comes through, it vibrates a particular part of the cochlea more than it does the rest. Those hair cells get to shaking back and forth. They rip open those ion channels. They send those electrical signals through the auditory nerve into the rest of your brain, and you go, huh, that was this frequency. It's that simple. There are these other membranes that move back and forth. You don't have to worry too much about that. All right. Here's that idea about the cochlea. Okay. Again, as you move out the cochlea, you go in, you change the frequencies, right? Okay. From high frequency to low frequency. Okay. One of the reasons, how many of you have heard of age-related hearing loss? Right? Yeah, so one of the first frequencies, now this is assuming you don't have some sort of occupational or recreational hearing loss, right? So if you are to listen to a sound of a certain frequency repeatedly, you'll actually start to lose hearing in that particular frequency band, right? And so you can do this to yourself. I wouldn't recommend it, but if you want to try it, prove, you know, you can prove if this really happens. As you get older, you start to lose higher frequencies first, though. And the reason for that is the part of the cochlea that's responsive, most responsive to high frequencies, is actually a little more brittle, right? And so when it vibrates, it's more likely to be damaged. So you can have some damage over time in those high frequencies, right? How many of you don't have to answer this, had a rather old teacher in high school, and you would often crank up the frequency on your message notifications on your phone so you could slide one by, right? Anybody do that trick? No, you guys aren't that smart. See, if you'd had this class first, then you would know you could do this, right? Some, obviously, slightly sneakier folks than you would do that. If you crank up the frequency, they'll do this sometimes in department stores too. If they think that young folks will come in and try to steal something, they'll have a real high-pitched frequency playing in particular areas, and that'll kind of, you know, it's just not very pleasant. It'll deter younger people, and then old folks can come in and do their shopping. So there you go. If you want to keep young kids away from your house, just like high-frequency squeals coming out all around. I'm thinking about like the inverse of a dog fence. You know, like when your dog goes out, it kind of shocks them. You could have like, nobody thinks that's a good idea. I did. All right. Questions about that? All right. Here's your inner hair cells, right? There's a cool thing here called the tip link. It's this guy. Why do they call it a tip link? It links the tips of these cilia, right? I mean, it's not a very creative name. It just tells you exactly what it does. So what happens is when the cilia move in one direction, in this case they move this direction, it creates some extra force, extra pull on that ion channel, and it literally physically opens that ion channel, right? The tip link is anchored to an ion channel on another cilia. When that cilia moves, it just rips it open, and then you can have an influx of, in this case, potassium and calcium. I know that's completely different than the story I told you before. You can ignore that specific part and just realize it's positive ions or cations, right, that come in, and they will increase the firing rate in that section of the auditory nerve. It's pretty cool. Yeah. Yeah, because you're floating around in endolymph, right? So it's encased in the cochlea in some fluid. You're not just out there, you know, like floating around. I mean, this is all right in endolymph in the cochlea, so it's all kind of in there. Does that make sense? Yeah, and they just your inner hair cells do, not necessarily in other places. Yeah. Probably not. Yeah, you wouldn't necessarily need to fire an action potential with the cilia. You know, if you're thinking about like some of the other cells that line your mucous membranes, yeah, they're not necessarily going to have these ion channels. You wouldn't need them there. You need them here because we're actually doing sensory transduction, right? We're taking those vibrations and we're turning those into electrical signals that we're going to send forward. So we have to have a way to get the ion channels in, or get the ions in, and that's through these channels. Once you get that signal out of the, once you get that out of your cochlea, there is a very complicated and convoluted pathway getting to your auditory cortex, right? I'm not going to ask you to memorize this. Just realize some information goes to the left, some information goes to the right. What we're trying to do here is compare arrival times of signals, right? And Melina, what we can do with that is we know if it arrives on one side a bit sooner than it does on the other, then we can anticipate where that sound originated, right? And that gives us some idea about the location of that sound, which is really important. It's important to know what the sound is, but also where the sound is, right? And so we can do this with these time differences. And that's really what I want you to take out of that. All right? All of this is sort of subcortical business. We eventually get in to the medial geniculate nucleus. This might sound familiar to something else we talked about previously, which was the dorsal lateral geniculate nucleus, right? You guys remember that 6-layered sort of bent structure that looks like a knee that we talked about in the visual system? This guy's very close to that, does a similar job, but it does it for auditory information and then sends that up to auditory cortex, which is sort of tucked in right there in your brain. That's the first place in cortex where you're going to get auditory information. Okay. The cool thing about this is the organization of auditory cortex matches the organization of the cochlea, so we still have that orderly sort of structure with the different frequencies. Now, when we talked about visual cortex and we talked about receptive fields and we talked about spatial locations, right? That was more of a direct sort of mapping situation, right? You map the actual physical world onto the back of your brain there and your primary visual cortex. Here we do things a little bit differently. We're more concerned with the frequencies, so we're going to organize it by frequency. All right. You've got some regions in auditory cortex. We'll talk more about these later once we get into sort of human communication. We'll talk about language and things like that. All right. We should briefly talk about cochlear implants, right? Anybody familiar with these? The concept here is pretty simple. You have part of the device that's going to collect sound information, right? And instead of going through the pinna and into the inner ear in that way, we're going to collect that information. We're going to use some electrodes. We can go right into that auditory nerve, bypass the cochlea completely, right? And we can get some auditory information into the auditory nerve directly. The reason this works, again, is that organized structure coming out of the cochlea. We know, from high frequency to low frequency, we have that organization. That organization follows through the auditory nerve into auditory cortex, and so we can kind of bypass that with these cochlear implants. They're not perfect, but they do tend to, they get better as hardware and software advances occur, so they can better sort of catch and interpret that information, right? Don't worry about this. Spatial location, we talked about arrival times. Not a big deal. Complex sounds. There's a lot of information going on aside from just frequency, right? I kind of just gave you, oh, we get frequencies, high frequencies, low frequencies, whatever. We have to take those frequencies and turn those into important things, right? Turn those into language. That's our brain regions dedicated solely to language sounds, and then there are non-language sounds, which is kind of interesting. But there's a ton of complex stuff going on in the auditory cortex. I don't want you to worry too much about that. There are also areas that combine visual and auditory information, right? So we kind of put that information together. How many of you have heard a noise and you've turned your head to take a look at that, right? Okay, so your auditory and visual systems, they interact a lot. And if you look at this, this is actually for a monkey. This is not a human brain. You can look at how much of the cortex, and it's pretty similar for humans, how much of the cortex is devoted to vision and then integrating vision with the auditory information. All right, don't worry about this and don't worry about that. Okay, questions about the auditory system before we move on? That's good. What about the vestibular system? This is kind of a fun one, right? Helps you with your balance. Keeps your head upright, and that's important. And it does adjust some eye movements, right? As you move your head around, it kind of does some things keeping your eyes focused on a particular area. You have two portions of the vestibular system that are important. You've got your vestibular sacs. These are mostly related to gravity. Okay, they're going to let you know which way's down, right? It's sort of what we call like static information. Gives you some idea about the orientation of your head, right? So if your head's upright, it's telling you which way is down. If you turn your head on its side, it still tells you which way is down, right? So it has that kind of interesting information. The semicircular canals, on the other hand, are a bit different. They actually respond to what we call angular acceleration, right? So this is, how many of you do somersaults? Anybody a somersaultist? I don't think that's what you call those people, but it's close enough, right? So if you do somersaults, if you spin around, if you accidentally rolled down a hill one time, your semicircular canals were giving you some information about that, right? And here we go. These three semicircular canals are your semicircular canals, and these two sort of sac regions are your vestibular sacs, right? And that should be fairly easy to keep straight. You've got two sets of these. You've got one set on the left side and one set on the right side, which is pretty nice, right? That way you can get differential information. If you're rotating clockwise or counterclockwise, one set is going to feel like it's or going to be moving in one direction, one's going to be moving in the other. We still have a similar setup here where we have these hair cells with the cilia and the tip links, right? Okay. And as they're moving one direction or the other, they're going to be activated or not activated. You can compare the left and the right and know if you're rotating or turning one direction or the other. Sydney, you want a story about sloths? I told you a story about mules earlier. I'll tell you one about sloths now, right? Sloths are exciting. So what's a sloth really good at doing? Well, I mean, moving slow. That's about all they do, right? So if you think about humans, and if I were to crack open all of your heads and pull out your vestibular organs, what I would find is there's not much variation from one individual to another, right? So Garrett, they're all very similar, right, from one person to another. Which, as humans, we don't think of ourselves as acrobatic species, but we are, right? And so we move rapidly through our environments, right? And you think about some of the interesting things that folks can do. We can do that because we have pretty good, pretty responsive vestibular organs, and there's not a lot of variation from person to person, right? If you had a really bad set of vestibular organs, you wouldn't do very well in life, right? Can you imagine trying to drive a car if you had bad vestibular organs. How many of you know someone or you've experienced yourself like vertigo, right? Yeah, that's because there's a mismatch between your vestibular and visual systems, right? And so you would be experiencing things like that constantly if your vestibular organs were really out of whack. Now, if you're a sloth, on the other hand, you're not moving very quickly, right? So there are two kinds of sloths. There's the ones in the tree, and then there's dinner, right? And if a sloth falls out of a tree, it gets eaten. Okay? And it doesn't need to worry about climbing back up. It doesn't need to worry about that, right? It's too slow. Something's going to eat it, right? It's just like you're walking along the street and all of a sudden there's like, you know, a cheeseburger wrapped up for you. You're like, well, I'm going to eat that. The cheeseburger doesn't have to worry about, right, Cody? It doesn't have to worry about like getting back into the restaurant because somebody's going to eat it, okay? Same thing with a sloth. Sloths actually have a lot of variability in their vestibular organs. So if you start cracking open sloth heads, and yes, someone did this, I mean, you know, sloths die. You find them. There's actually a lot of variability in the genes that control sloth vestibular organs, right? And so there's some variability there. Because they can afford that variability. Having a good set of vestibular organs is not important for a very slow-moving species, right? For a faster-moving species, it's quite important to us, so we don't want a lot of variability there. We want some tight control on that, okay? I think they're all clumsy. Some are clumsier than others. I'd put it that way. So none of them have really good vestibular. They're not moving fast enough, right? So if you think about a sloth, does it have any need for semicircular canals? No, because the angular rotation, it never knows, it's never moving fast enough to even deflect those hair cells, right? So you're never going to engage those. And you wouldn't engage your semicircular canals. If you're just like walking, you're probably not really engaging your semicircular canals. Your vestibular sacs are involved a bit, but your semicircular canals are not going to be involved. Now, if you start running, if you start playing sports, if you do some other things like that, I don't know, parkour, you guys into parkour, anybody? Maddie thought that was funny. I don't know. Do you know a parkour enthusiast? Yeah, that's the best episode ever, right? They jump down into that refrigerator box, Ed Helms, parkour, and he disappears. It's a good episode. I didn't watch the rest of the show, just that episode. So don't ask me about anything else. I know about the time Kevin put tissue boxes on his feet. And that's it. I just know the episode's about cardboard boxes, I guess. So there you go. Kyle, did you watch that show? Yeah. Explains a lot. So, sloths don't really need. So why would they waste their resources on that? There's no selection pressure on that over evolutionary time, right? For humans, there has been humans that had bad semicircular canals. They were dinner, right? So they weren't able to move quickly. They weren't able to get out of harm's way and do the things they need to do. Here's a little more detailed view of how your vestibular sacs work. You sort of have these ear stones, right? These otoliths that are, since gravity pulls on them one direction or another, and it can deflect these hair cells. As the hair cells are deflected, you get some sensation of this ways down, right? It's not too complicated. Here's a nice sort of electron microscope view of the hair cells here. This is actually from a bullfrog. I don't know if you guys ever wanted to look at the hair cells of a bullfrog, but here they are. So you have these kind of cilia sticking up. You can see that. See how they're kind of stacked in one direction? Right. So this side's higher and this side's lower. That allows them to, when they move in that direction, the tip links create that tension and open the ion channels. When they move in the other direction, the tip links are slack and they're not going to rip open those ion channels, right? So you're not going to get excited. And if you think about orienting these things in there in different ways, right, you're always going to have some set that can get activated, and you can compare that to your the other cells. Not too big of a deal. All right, so vestibular system, we're done there. What about body senses, right? Somatosenses. Okay. You have, you can break this down into a lot of ways. One of these is if we think about cutaneous senses or skin senses, right? So for that, we're thinking about touch, tickle, vibrate, hot and cold, pain, right? Things that are kind of in your skin. We also have a couple other things, proprioception and kinesthesia, right? This is your body while it's kind of at rest, like what is it doing now? How many of you know where your feet are without looking at them? Hopefully most of you, right? If you don't, you need to see a neurologist. How many of you can walk without watching what you're doing the entire time? Okay, again, most everyone can do that. Some people have trouble. If you're just clumsy, that's different, but you know, if you have some real problems, there are folks who have sort of the inability to move parts of their body unless they're actually like looking at them, right? They have some brain damage that prevents them, which is really interesting, from moving their arms, for example, unless they're actually like looking at their arms. I wouldn't shoot for that. Like if you're thinking about like, hey, what's a cool brain disorder to get, don't try that one. It's just a real hassle. And then we have things called organic senses or visceral senses, right? These are senses of your guts. You're typically not aware of these. This is when you're kind of monitoring your blood for oxygen levels, or you're monitoring body fluids for different sort of, you know, do I have enough fluid? Do I have not enough fluid? Is there more sort of things dissolved in here than there should be? What's the CO2 levels, you know, in different places? These are sort of body senses in the sense that we're keeping an eye on our internal state, right? What about your blood pressure? How many of you know your blood pressure right now? How many of you know you have a blood pressure right now, right? There's part of your brain is monitoring this, right? There are stretch receptors in your blood vessels, right? And they're going, okay, this blood vessel's stretched a bit or it's not stretched a bit, and what are the internal mechanisms that we can do to kind of adjust that, right? So we kind of monitor these things. Typically, we're not aware of these, right? You're not thinking right now, I wonder if I've got enough CO2 dissolved or not dissolved in my blood, right? It's not something that's at the forefront of your thinking. Should we talk about pain? Right? We should talk a little bit about pain because this is interesting that it kind of relates to what we talked about a couple weeks ago when we talked about psychopharmacology, right? And I said to you that the reason any drug that you take works is because it mimics some molecule inside your body, right? And there are actually endogenous opioids that you create inside your body, right? When you take an opioid, you take morphine, for example, it mimics that endogenous opioid, right? These endogenous opioids, they do help reduce pain, right? Great way to release endogenous opioids, like, you know, stump your toe, right? And just kind of kick something really hard, and you'll release some endogenous opioids, right? Don't worry too much about this. The basic idea is that, you know, eventually you're trying to get to some inhibitory effect, right? That way you can turn down this pain sensitivity. We're going to ask you a lot about pain processing. What about your cutaneous senses? Others, you have a number of receptive organs embedded in your skin. These are all sensitive to different types of different stimulus classes, right? So some of these are going to be sensitive to touch. Some of them are going to be stretching or vibration. Some of them are going to be sensitive to hot and cold. I don't expect you to memorize this. Just know that for each type of stimulus, you have to have a different kind of receptor, right? You have to have a different type of receptor for each type. And here you go. Here's a nice chunk of skin. I don't know if you guys have ever plucked out a chunk of skin, taken a look at it. This is what it looks like. You have different sort of receptors. They're designed different ways. They're structured different ways so they can be sensitive to a different kind of stimulus. It's that simple. There you go. There are your different kinds of cutaneous senses. Don't worry about that pathway. And don't worry about that. Again, I'm not going to ask you much about pain. If you're interested in it, I recommend you check that out. Phantom limb's kind of an interesting thing, right? Folks will often still sort of feel that they have things going on in amputated limbs. Right? There's a guy a number of years ago, V.S. Ramachandran, who sort of figured out ways to treat this. He basically built a box, had a mirror in it. Okay. And if you were to stick your arms in, and you could kind of look at that mirror, right? You couldn't see this side. And then it would look like you had your other arm. You'd go, oh, well, my other arm's there. And if you thought your other arm was itching somewhere, you could just scratch it over here. And you're like, oh, well, I feel better now because I actually saw someone scratch my other arm, right? You got some interesting feedback on that. It's pretty cool, right? Anybody ever been to the Brain Expo they have here on campus? Anybody see? Yeah, Sydney, right? So they have this like rubber hand illusion. Have you heard of that? It's quite similar. So you have someone stick their hand and they can't see it, and then they have like a rubber hand out there as well that's like on the same side. I only have one hand on each side, so I can't. It's kind of hard to mimic, right? So you have two hands, and then you use like a paintbrush to kind of tickle both hands at the same time, the rubber hand and the fake hand, and then they eventually feel the touch on the fake hand. It's actually kind of fascinating. Yeah, and then you can kind of like reach out and like you're going to hit it, and they'll jump back. It's fun scaring little kids. It's usually little kids they bring in. I get to do this one because I have fun scaring them. All right. Oh, hey, who loves placebos? We talked about placebos in this class? No? A little bit. I thought we did, right? Yeah. So placebo effect is like a very real thing. I don't want you to think that it's not. This is actually probably one of the coolest slides. I think we did talk about this briefly. I'd like to bring it up again. They had two groups of folks. They gave both of them a placebo. One group, they told them it was a high-priced placebo, and the other said that it was low-priced. And the folks who received the high-priced placebo, they actually reported better alleviation of their pain. Even though it was the same placebo, they were just told that it was more expensive. And I know it's kind of interesting, right? So that's what I do. I just, I go home and I eat Skittles when I'm in pain, and I tell myself it's a really expensive pain reliever. And the S stands for super pain reliever. And when I eat those, then I feel better. You should try that, Kyle. It doesn't work as well when you do it on yourself, but it still works. How many of you have ever been to the doctor? You went to the doctor because, oh, you're having some problem, right? And as soon as you get there, the problem disappears. All the time, right? And you go in like, hey, I got this weird thing with my eye, but it's not doing it now. I'm like, well, how can you make it happen? Well, I can leave, but you're not going to be there. And that actually happens sometimes, right? So these placebo effects happen and you don't even realize it. It's kind of fun, right? So what you should do is just get like this is a great way for healthcare. You should just get a mannequin and put a lab coat and a stethoscope around its neck. And then anytime you're feeling bad, just like walk over. Melina, you don't think this is going to work? I think it will. You walk over to it, you just like out of its pocket, you pull a little slip of paper that's got prescription written on it. And then you just like, take it over to your cabinet and, I don't know, pull out some candy. I think that would work. That's not going to work as well as like an actual diagnosis and treatment, but it'll help. So, you know what they can do, Kyle? Because I'm telling you this because there's some day coming up. Is that the right day? Let's see. When I think 6 of you are mysteriously going to get a disease, that's exam day, right? And there are a number of you who are going to go that day, and you're going to get sick, right? And I'm not going to tell you now, but I'll tell you later that like sometimes you actually do get sick during exam time, right, because of the stress, and there's some interaction between stress hormones and your immune system, and that's an interesting story we'll talk about later. But what I want you to do, instead of missing class, is just get up that morning and go over to your doctor mannequin and get your little prescription and go back over and get your junior mints out of your cabinet, and then you'll feel better and you'll come to class and do great. Nobody thinks that's going to work? Hey, Kyle, you know what we should do on the 3rd floor? We should get us a mannequin and just put little slips of paper in there that say prescription, and then we could have another room with junior mints, and students can come over and get a junior mint prescription, and then they'll feel better. You think that'll work? Who might get kicked out? The students for taking all of our junior mints, or me? Both. I think that sounds like a study you should do, Laura. Questions about placebo effects. There's also something called the nocebo effect. This is not something I'm making up. This is real. How many of you have ever taken a you don't have to answer this, taken a medication that had side effects and you experienced one of those side effects, right? It's fairly common. So there's this fine line between like telling you what side effects there are and actually maybe telling you too much, because people who are, the more aware you are of the side effects and the more you think about those and focus those, the more likely you are to develop those side effects. So there you go, right? So again, no side effects to junior mints. I mean, I guess at some point there is, but you have to eat a lot of them to worry about like tooth decay and other, sort of issues. It's got a wide margin of safety, right? That therapeutic index. See, Kyle, this is such a great idea. You should work on the IRB protocol. Placebo effect. Your brain actually gets activated in a couple regions. It's kind of exciting. Hey, speaking of junior mints, let's talk about eating, right? And gustation and taste. So this is known as a chemical sense, as is olfaction or smell. The previous sensory systems we've talked about were light. We talked about sound waves. We talked about touch, spinning your head around, gravity, all that kind of fun stuff. For taste and smell to work, though, you actually have to expose your sensory receptors to the chemicals, right? To these volatile chemicals, right? That's how you taste things. That's how you smell things. When you so for the substance to be tasted, you have to dissolve them in the saliva in your mouth. Most of your taste receptors are on your tongue. You've got a few some other places. Not a big deal. There are really they say there are 6 qualities of taste, right? We usually think about sweet, salty, bitter, umami. I know there's another one. Sour, that's it, right? And sometimes people who will talk about, like on the 6 qualities, sometimes they'll talk about spicy, right? Or sometimes you can detect like fats, or there's even a new group of folks who are looking at whether or not there's like a carbohydrate taste bud, which is kind of a new sort of thinking on things. Don't get too worked up on this. The basic idea is that you've got your 5 basic tastes, right? And these are the 5 that we really want to think about because we know the most about these. They're actually keying in on specific molecules, right? Specific chemicals. So let's think about if something is salty, what chemical or molecule do you think you're detecting there? Yeah, right. And that was the easy one, right? I didn't want to try to be too tricky, but yeah, we're thinking about sodium, right? What about like sweetness? Things like glucose, right? That's a pretty obvious molecule there. Sour, we're typically looking for hydrogen ions. These are indicative of something being acidic, right? So if you think about a lemon, for example, right, high in citric acid, right? So we have high amount of protons there. Bitter, these are typically plant alkaloids. Okay, so that's a K right there, by the way. Plant alkaloids. Trying to think about like coffee. Anybody a coffee fan? No, right? Coffee's a waste. It's awful. How many of you drink coffee? Yeah. How many of you actually drink coffee, and how many of you drink like cream and sugar and flavor with just like a little bit of brown liquid in it? And that's probably what you're really drinking, right? Why is that? Coffee by itself, like straight coffee, it's bitter, right? Because you're sucking out those plant alkaloids, right? And typically things that are bitter, they're actually usually poisonous. There you go. That's, I don't know. We could. There you go. We'll talk more about caffeine too next week. We'll talk about what it does to your adenosine receptors and how it tricks you into. I don't want to get too much into that, but yeah, it's caffeine is caffeine's an interesting molecule. So stay away from coffee. I don't own any stock in Starbucks yet, so got to try to steer you toward my investment portfolio. Yeah, I don't have one, but when I get one, I'll let you know. And then finally, umami. That's savory, and we're typically here keying in on amino acids, in particular glutamate. So, for example, MSG, right? Monosodium glutamate, huh? Yeah. So any that savory, that it's a little harder to describe, but it's not one of those four, right? So it's going to be high in amino acids. That's what you're gonna have there. It's umami. That's actually a Japanese word. It was described by a Japanese scientist. So there you go. All right, your tongue has receptors on it. You've got papilla. Inside those papilla are your taste buds, right? Your taste buds are actually inside the papilla. So you have these kind of like pits on the surface of your tongue. I know, it really sounds exciting, right? That's actually probably what you're seeing when you're actually looking at your tongue. You're not really seeing your taste buds, right? Because your taste buds are inside of those pits. And inside each of those taste buds are a number of taste receptors, right? And you have taste receptors that are sensitive to those different molecules that we just discussed, right? And so when you dissolve whatever food that is, those molecules fall down in those papilla. Your taste buds are there with your taste receptors. They get excited by those molecules. Don't worry too much about this just yet. You've got a, gustatory pathway, not a big deal. Goes up to your gustatory cortex, not organized in any sort of way, right? Like if you were going to think about, again, that like high frequency to low frequency, that made some sense. How are you going to organize these different qualitative tastes, right? It just doesn't make any sense. So you're not going to waste your time doing it, okay? You do have a little bit of a jump off here that goes to the amygdala. The amygdala, again, is that fear nucleus. Okay, we'll talk more about this. We call it conditioned taste aversion, right? How many of you have a restaurant in town you'll never eat at because you went there once and you got sick, right? Most people have a place like that, right? They've got maybe even more than one. You won't go back. It's probably perfectly fine and safe place to eat. Everybody else tells you how wonderful it is, but you went there one time and for some reason may or may not have even been related to the food you ate there, but you got sick after and you're like, I'm not going to chance it. Okay? All right. What about smell? Right? It's kind of a logical extension of taste. Okay, it is a chemical sense again. So anything that you smell, a small piece of that has to be up your nose. It's really thrilling, right? I think about all the wonderful things you smell as you're going about your day, right? Anybody have pets? Yeah. Now you're rethinking this, right? Like, I don't know. Get something like a lizard or a snake. They don't create a lot of waste. They don't eat a lot. Right? Lindasia, you're on this, right? Yeah. Or just, get a fake house plant. That's even easier. Why is smell really good? It lets us know if something is edible or if it's spoiled, right? There's another way you can know if something is edible or spoiled, and you just, cram it down your mouth, right? But the problem with that is once it's already in your body, it can cause you some problems, right? So if we can tell before, like, hey, I probably shouldn't eat this, it'll really help you out a lot, right? So we will smell things, okay? You've got a bunch of olfactory receptors, right, up in your nose. They're going to catch all of this. They are constantly creating new receptors, which is kind of interesting. So you have your olfactory receptors hanging down here into your nasal cavity, right? Okay. You have probably, I don't know, 1,000 different kinds of olfactory receptors. The interesting thing about this is you can identify about 10,000 different smells. That's pretty impressive, right? So for homework, I want you to list all 10,000 smells you can identify. Only take you a couple weeks. So you don't have to do that. But think about it. How, with only 1,000 receptors, can we recognize 10,000 odors, right? That seems like it should be a one-to-one relationship, right? But it's because we do this like combinatorial business, right? So basically, how many of you have seen those little combination locks on your bicycle? Anybody have one of those? Like one of those little barrel locks, you know? It's like 4 digits typically, right? And it's 0 through 9, okay? And you can create about, with just those 4 positions, and each one of those representing one of 10 possible choices, you can represent like 10,000 different possible combinations, right? Now some of them are really secure, like 0, 0, 0, 0, so even if you throw those out, you still have a number of combinations, right? And that's just with 4. And so if you think about, if I had 1,000 different receptors and I can combine these in different ways, right? They all, maybe 5 or 10 get excited for a particular odor and a different 12 or 13 get excited for something else. You can think about all the different ways you can combine these receptors and their activity to make unique odor experiences, right? And that's what happens. We also have, once you have an odor, once you have that going into your, going through your olfactory system, we have a couple places where we're going to jump off. One's going to be the hippocampus. That's a place where we're going to think about learning and memory. That's going to be exciting. We've got a jumping off point here with the amygdala as well, right? That's also going to be exciting. Again, we want to think about that fear sort of experience, right? How many of you have smelled something and you've been afraid of it? May or may not be as important to your day-to-day life, but imagine you're a rat. Probably what's the most fearful thing you can smell as a rat is cat urine, right? So if you smell cat urine, you're going to run from that, right? Okay. There's another jumping off point called the hypothalamus, which is kind of interesting. And later in a few weeks when we talk about reproductive behavior, we might think about why the hypothalamus, which controls a lot of hormone release, is going to be really important for like the things you smell, right? We'll talk about all kinds of fun things you can do to either jumpstart or stall puberty. So if you're interested in those. Don't know if anybody's been through that yet. I assume at this point in your life you have, right? But if you wanted to mess around with someone else's puberty, that might be fun, right? I don't know what you do in your spare time. I don't really want to know. Here's that sort of combinatorial coding information, right? So you've got some kind of molecule and it'll activate. Here's a simplified example, just 2 receptors. Here's a different molecule, and it activates 2 receptors as well. One of them is the same, but notice that one is different, right? And it's based on that pattern of activation that we can identify these molecules. It's not which one individual receptor is activated, but what's the overall pattern of activation, and then we can make some sort of assessment of what that is. All right, questions about that? It's not so bad, right? So that's what I'd like for you to get out. Out of the sensory systems, right? There are some broad overarching concepts to think about sensory transduction, right? Whatever sensory system it is, we're taking some stimulus and we're eventually converting that to an electrical signal, right? How we do that's slightly different for each sensory system, but Ebony, it's the same idea, right? We're taking sound, we're taking light, we're taking hydrogen ions, whatever it is, and converting that eventually into an electrical signal that the rest of our brain is going to understand, right? And we can interpret that. All right. Let's think about movement for a little bit, right? That's going to be exciting. Let's go back to that three-step process. Input, calculation, output. Movement is quite clearly an output, right? I mean, it is sort of the final culmination of this process is you're going to move, okay? You're going to make some sort of movement, whatever that is. You've collected sensory information about your surroundings. You've taken that information and made some decision about what sequence of movements you need to make, right? So like right now, okay, you're collecting sensory information, right? You're listening to the sounds around you. You're feeling the seat. You might even be feeling things like your bladder filling up, right? And so you're trying to make these calculations. Is he going to say something really important in the next 2.5 minutes? Because if he is, then I can probably wait. But at some point, the relationship between what I'm going to say and how important it is and the fullness of your bladder, those things are going to, right? And somebody's going to have to leave for a few moments and then come back. So you're making that calculation. Then you make that output. You decide, finally, I need to get up and I need to leave. Here's how I'm going to navigate my way out. Here's how I'm going to do it, making the most noise possible, right? So I can attract the most attention, and you're going to make that sort of sequence of moves, right? There's your output. What are some things that we might want to think about as we think about movement? Skeletal muscle. For our purposes, there are other types of muscle, right? We think about cardiac muscle, we think about smooth muscle. We're not going to necessarily think about those. We're not really going to focus on skeletal muscle too much. I've got a couple slides you can look at briefly as we're flying by about sliding filament theory and so forth. If you want to think about those things, they're really exciting and they're really thrilling, but we're not going to spend a lot of time on that. We'll think a little bit about brain spinal cord issues, complex motor behavior, which is going to be exciting, and the apraxias, right? So there are weird things that can happen with your ability to move, which is something that some of you might find interesting. Skeletal muscle, you can flex and extend stuff. All right, I don't want you to get too much out of this. I do want you to think about motor units, right? We're not going to spend too much time thinking about these other concepts here, but let's think about the motor unit for a moment. What is the motor unit, right? That is a motor neuron and its associated muscle fibers, okay? So you've got one motor neuron and it's going to control some number of muscle fibers, right? It's kind of interesting. Depending on the location of that motor neuron and what muscle fibers it's controlling, it may control a large number of muscle fibers or it may control a small number of muscle fibers, right? And a lot of that depends on the type of movements you're going to make. So let's think about your legs for a few moments, right? Motor units in your legs are going to be relatively large, right? They're going to have a large number of muscle fibers, okay? You're not really making fine movements with your legs, right? They're kind of just forward and backward, and then they bend a little bit, and that's it. So you can have that larger motor unit, right? If we want to think about something with your eye muscles, for example, these motor units are much, much smaller, right? And in fact, one motor neuron may only be controlling like one muscle fiber, right? Okay, because your eye movements need to be very exact, they need to be very precise, they need to be very controlled. So we will devote a number of neurons to controlling the movement of your eyes. We won't devote as many to controlling the movements of something like your leg, where you're not going to have as fine or as precise of movements necessary. Does that make sense? And here's a woman. You can look at that or not. Basically, you've got your skeletal muscles. Not too big of a deal. You've got some receptors in there. You've got some information coming down. We're going to dump out acetylcholine. It's going to cause contraction. There are a bunch of fancy words they will use, like motor end plate and some of these other things. I don't want you to get too bogged down with that, right? There's a really fancy word called the neuromuscular junction. And that basically just means that's where your nervous system meets your muscles, and they can communicate there. One of the cool things about your brain, right, speaks electrical. Okay, right? It speaks with electrical impulses. Your muscles do the same thing, right? They understand these electrical impulses. And so that's why your brain and your muscles can communicate. They're both excitable tissues, right? Electrically excitable tissues. So they can communicate with each other using that same sort of system, which is pretty cool. That's a good question. It was a question about handedness. Did you want to answer it? You didn't hear what he said. I don't know. I honestly don't know that anybody knows. So I could go on a huge rant for just like a very long time about this, right? About how little we know about handedness and how I think actually important it is to understanding like the way your entire body works, right? So I don't think anybody actually knows. If you're interested in that, that would be a fun thing to figure out. I think we could do it. Yeah, I mean, you just got to like cut off a few arms, right? Dissect them, pull out. I think there's probably an easier way to do it. But we know very little, in fact, about handedness at all. Probably 10% of the population is left-handed. How many people in here are left-handed? Okay. How many of you have? How many of you think you're left-handed?
I do everything on my left except right.
Okay. Did he send you an email?
I haven't yet.
But you're going to today, right? So there are probably 10% of the population is left-handed, right? Which is actually a sizable chunk if you think about it. And we know less about like left-handed brains and how that, you know, and by extension, things like motor units in left or right hands or left or right feet even, right? I mean, some people can be left or right footed, for example. We know less about left-handed folks than we probably do other groups of individuals. So if you think about folks who've been diagnosed with schizophrenia, right, that's probably about 1% of the population. And we know more about the brains of individuals who've been diagnosed with schizophrenia than we do people who are left-handed. Now, that's not to say being left-handed is the same impact on your life as dealing with schizophrenia, right? I'm not trying to make that. But it's a tenfold more people who are left-handed, and we just don't know anything about it. So there's a group of folks here on campus, right, Laura, who are interested in trying to figure out how this stuff works with left and right-handed folks. So, yeah, it's a good question. Part of me wants to say, no, I don't think there would be a difference. And then part of me wants to say, yeah, I think there probably would be. But I don't know if that difference would be like an initial, because we don't know, like what causes someone to be left or right-handed, right? And there are probably environmental things, right? Let's say you've been left or right-handed for 40 or 50 years, then you're probably going to have better developed, right? Training and experience and things are going to play into that. Was there a developmental difference or a difference at the beginning, right? In left and right-handed individuals, that would be exciting, right? And then you'd know if it was some sort of, I don't know. So the answer is I don't think we know, but Yeah, if you wanted to try to find that out, I think that would be exciting. Not as interested in it as you thought, right? That's okay. Don't worry about that. Here's your basic, you know, actin and myosin and things, and that's how stuff happens. I'm not going to ask you about that. There's your motor end plate, and you've got an end plate potential, right? Don't be confused by this. It's just a postsynaptic potential, right? Same thing we've already talked about. There it is. And then your Golgi tendon organ, these are actually sensitive to stretch, right? One of the things that you have a number of reflexes, right? And one of those is like your patellar reflex, right? Anybody familiar with that? You get kind of chopped in the knee and you kick your doctor in the face, right? Yeah. That's not how you do it. That's why they only let me come back once a year. Come in wearing a football helmet just in case. The reason you have the patellar reflex is actually when you push on the tendon there, what it's doing is it's stretching, right? It's stretching your muscle, and your muscle responds to that by contracting, right? Because you don't want to like overstretch, and that causes your lower leg to kick out. It's kind of a fun experience, right? Don't worry about this. Again, you can look at activity when you're like holding a weight and you're feeling that stretch. Not too concerned about this. This monosynaptic stretch reflex, that's what we're talking about just now, that patellar tendon. There are some polysynaptic reflexes as well. I'm not going to spend a lot of time asking you about reflexes. Kind of move past this. All right, so that's kind of basics of movement, but we do want to think about what's going on in your brain, right? How is your brain controlling that information? How is your brain getting information back about the movements you've made? So you have a number of brain regions that are involved in movement. One of those that we think about is the primary motor cortex. The interesting thing about the primary motor cortex is I like to think about it as the opposite of your primary sensory cortexes, right? So we had said, Sydney, that primary visual, primary auditory, that's the first place in cortex that we're getting information, right? In fact, primary motor cortex is the last place that we have motor information in the brain before we send that command down to the rest of your body, right? So primary motor cortex is the end of that situation. We've got other areas like premotor cortex, your supplementary motor area. These are areas where we're planning these movements, we're getting these things ready before we send that information to primary motor cortex and then out to the rest of your body. We do have motor cortex organized. We have that somatotopic organization, so it's organized by your body. We've got a fun guy here called the homunculus, right? Which sort of means distorted human, right? I know, he's like really exciting, right? Just want to go up and give him a hug. Certain parts of your body are more important than others. You can do more with them, right? And so I think your hands are a great example. How many of you have hands? Okay. Put them up in the air if you want. You don't have to. And then you also all have a back, right? So if you think about all of the fun things you can do with your back, like hold up a cape, I think that's about it, right? That's like the end of the list, okay? You got a back, you can't really do much with it. There are a ton of muscles. Anybody know how many muscles you have in your back? The answer is a lot, right? There are a bunch of muscles there, but what are they doing? They're kind of holding you upright. They help you like, stabilization and so forth. You're not doing anything fancy with them, right? But let's think about your hands for a few moments. And let's make a list of just like 3 things you can do with your hands that are cool. Shadow puppets. That's at the top of the list. You can play an instrument like the clarinet, right? We talked about that. And you can take notes in class, right? All 3 of those things are things that you can do with your hands. You're not trying to do them with your back, okay? So even though your hands are a lot smaller than your back, like on your actual body, when it comes to brain real estate, we're going to give more of that space to your hands because they can do more. They're more sensitive. So if you're to like jab yourself in the finger, right? Galen, you know all about jabbing people in the fingers with things, right? You can measure how close you can get those two dots together and go like, yeah, they're still separate compared to your back. Your hands are more sensitive than your back. Your hands can do more. They interact with the world in a different way. So we will give more space. So if you look here, I mean, there's like thumb and fingers. Like, look at that big chunk of brain. I don't even think they have back on here. I mean, they've got like shoulder. I guess that'll work. Somewhere between shoulder and abdomen. They didn't even really give a space for it on that chart, right? Because your back's not doing a whole lot. So we're not going to give it a whole lot of space in our brains, either in the motor cortex, primary motor cortex, or in that somatosensory cortical area, right? It's all about the importance, right? So if you think about this like a, like a sports team, right? Does the largest guy make the most money on a football team? No, he probably makes the least money, doesn't he? Yeah. Yeah, the smallest guy usually makes the most money, right? I mean, unless there are a couple of exceptions. Trying to think. The only exception, like Cam Newton's probably not the smallest guy on his team, but he might make the most money. So that might be the only exception. Usually, like your quarterbacks make more money than anybody else, right? But they're usually the smallest players. Your offensive lineman, your left tackle, he probably is the biggest guy on the team. He's not making nearly as much money. Although if you ask a quarterback, that left tackle may be one of the most important people on the team. Hey, who loves monkeys? Nope. One person? You just raise your hand for everything, I think, right? Is that true? You can raise your hand for that if you want. It's actually kind of an interesting study. With monkeys, they were stimulating motor cortex, some prolonged stimulation, and they were actually able to initiate sort of complex movements, right? And one of the interesting things I think about this is if you look at all of these all except like this one, anytime they activated one of these other regions, it's actually something like involving the hands, right? That the monkey would move their hands to different places. They would reach out like they were going to grasp something. So even in monkeys, hands take up a lot of brain space in the motor cortex. So I think that's kind of an exciting thing to think about. Don't worry about these pathways too much. I'm not going to ask you about that. You can learn those if you want. They're exciting. All right, we want to think about planning movements, right? So we do take in a number of sets of information, right? From visual, somatosensory, vestibular, auditory information. We talked about all of these types of information in those sensory system lectures, right? We integrate all that information. We send it all up to frontal cortex, where we can plan these movements, and then we send that information out through that primary motor cortex. So this kind of shows you the path, all of that sensory information going forward, and then working our way back through these other motor areas until we get to that primary motor cortex, and we send that information out to whatever muscles we've decided to move. Okay? All right. There are some subcortical regions involved in movement that we want to think about. We briefly discussed the basal ganglia before. I don't want to spend a lot of time on that right now, but we'll talk about those later as well. There are a number of movement disorders, Parkinson's disease, Huntington's disease, that are the result of damage to your basal ganglia, specific parts of your basal ganglia. Also, like motor memory, we'll talk about that. That's going to involve your basal ganglia. The cerebellum is an interesting brain structure because it deals with sort of feedback, right? So as you make movements, you're anticipating a set of information to come back to you to indicate that you've completed that movement successfully. Your cerebellum is involved in that. We discussed this when we talked about the effects of alcohol and how it sort of affects cerebellum activity quite a bit. That's why movements when you drink alcohol are distorted. Okay. Don't worry about these. Cerebellum, bunch of parts. And there's direct and indirect pathways. And the basal ganglia. I do want to spend some time talking about mirror neurons. Anybody heard about mirror neurons before? Yeah, they're kind of interesting, right? This was an Italian group a number of years ago, well, actually not that long ago, that discovered these mirror neurons. What they found is that there are some neurons in the premotor cortex, right, that get excited when the monkey makes the movement or when they see someone else make that particular movement, right? So whether they're making the movement themselves or they're seeing someone make that movement, those same cells get excited. Okay. Kind of interesting. Now, there have been a number of folks since that first group that have said, hey, mirror neurons are the, sort of at the base of a lot of things, right? Folks who have autism, they have a distorted mirror neuron system. Well, it's been difficult sort of demonstrating that. But there is some cool stuff with mirror neurons, right? They did a study with humans, looking at musicians and non-musicians. They would watch these clips of someone playing instruments, and they would see that there were circuits that were excited while watching and while performing an activity. If you think about the way that we learn, how many of you have learned something by watching someone else do something? That's exactly how you learn a whole lot of things, right? Is by watching someone else. So it makes a lot of sense that when you see someone else perform an activity, there would be in your motor cortex, there would be cells that would get excited by that, and they would be the same cells that get excited when you perform that activity. But when these guys did this in the early 2000s, they were sort of the first folks to demonstrate this. It was really it was really sort of an exciting thing, right? Don't worry too much about this. Reaching and grasping, they're important, and they have different brain regions that control it. We should talk about apraxias briefly, right? This is when there's damage to your cortex and it creates a movement deficit. This is not someone who has had, so we probably all think about someone who's had a motor cortex stroke, right? And they have some difficulty moving half of their body, right? Which is a serious thing. This is slightly different than that, right? And so these individuals, if you have something called limb apraxia, you will, like if you try to move, let's say your arm, you'll actually end up moving your leg instead. Or if you try to move like your lower leg, you'll actually start moving, your upper leg instead. It's really sort of an interesting set of situations there. And then there are these folks who can't make copies of drawings, but don't worry about that. Part of this with this constructional apraxia is it's about feedback, and I think I'm going to write that word again. Any idea why I'd write that same word more than once? Because feedback, I think, is one of the most important parts, right? When we think about that three-step process, input, calculation, output, the output has to come back around and become an input, right? So we have to think about that sort of circular nature of the situation. And when these individuals, when they're trying to copy this, right, what they'll do is they'll continue to kind of make, make lines over and over again because they're not getting the feedback that they actually successfully completed that activity. Later, when we talk about language, we'll talk about stuttering. Stuttering is a similar situation. Individuals who stutter aren't getting feedback about the words that they're saying, so they continue to repeat those words or those syllables until they receive that feedback, right? So they're going to continue to make that same sound until that pathway is activated that says, yeah, I successfully completed that part of the sentence, I can keep moving on. So again, feedback is such an important part of what your brain does. It's I think it's often overlooked, right? Yes, you're collecting information about what everything else is doing in the environment, but you have to recognize you're an important part of that environment as well, right? And what you do and how you move and how you manipulate yourself and the things around you is actually highly important. Questions about that? Okay. I don't really want to go on to chapter 9 right now.